They literally are trying to take health care away from millions of Americans at this very moment in the dead of night.
Oh, my God.
Oh, my God. It's a party of monsters.
That's why they're having
They're not Republicans. They're monsters.
That's why they're having the 1 a.m. vote tonight on the big, beautiful bill to try to slide through in the dark of night. The cutting back on Medicaid.
And so the Republicans who are actual vampires can come out to vote, too, because, you know, the sun is down. So Craig Gottwals, originally Craig the Obamacare lawyer, because when Obamacare was in the works and passed, Craig would talk to us about it, longtime friend of the show, and everything he said was true, and virtually everything he predicted happened, in contrast to most of the coverage of it, which was garbage. Well, Craig is now Craig the healthcare guru, and we're going to talk a little bit about Medicaid, among other things. Craig Gottwals, how are you, Craig?
I'm good. How are you, gentlemen?
Terrific. Thank you very much. So what do you make of Hakeem Jeffries' quote there, and what is the reality of Medicaid?
Well, it underscores just how we can never give anything to the government. This is why we can't have nice things, right? So in 1965, the federal government passed Medicare and Medicaid. And specifically with respect to Medicaid, the whole idea was, man, we need a safety net for like single moms with disabled children who are falling through the cracks. We need this mechanism to just capture the most disadvantaged among us, to help them out and to give them a lift, right? So we did. And back when this was passed in 1965, it was designed to cover 2% of Americans. 2%. Today, it covers 1 in 3 Americans and 41% of all babies birthed in our country.
Whoa! 41% of babies born.
So originally for the blind, the disabled, the utterly unable to help themselves, and now it is approaching half of us.
Is that because we have so many more single moms with blind babies, or what has happened?
Well, you know better than I, Jack. This is entitlement creep, government creep at its finest. I mean, when this really took off and became insane was with Obamacare in the early 20-teens. When Obamacare came into play, Obamacare was bribing the states because the way this thing works, it's an agreement between the state and the federal government, and there's shared financing, right? So the federal government couldn't just say to the states, you shall expand Medicaid. But what the federal government did is said, hey, look, if you expand Medicaid, to basically able-bodied working-age people now, because we'd already, had Medicaid for all the other categories you just mentioned, Joe, the government said, look, if you do that, the federal government, will pay 100% of it for some time, and then we'll pay 90% of it. So all but 10 states went ahead and said, heck yeah, we'll take that deal. And so now with that Medicaid expansion that occurred with Obamacare, it's 90% paid for by federal taxpayers, and it covers anywhere from 8 million to 14 million able-bodied working adults, or I should say able-bodied adults, some of which are working, some of which aren't.
And in a bizarre twist, correct me if I'm wrong, the federal government compensates the states at a much higher percentage for able-bodied dudes smoking pot on their parents' basement couch than they do for actual, disabled people and blind babies.
Yeah, no, that's exactly right. So that was the Obamacare bribe because Medicaid already covered all those people we were trying to protect, when we started this thing in the 60s. So it covered all those people that had disabilities, single moms, et cetera, the blind, the disabled. But it didn't cover just underemployed or unemployed able-bodied adults. And so in order to get the states to agree to do that, the federal government had to say, look, we know that we're only paying you an average of 50 to 65 cents on the dollar for your existing Medicaid. And we know that's not enough to get you, the states, to agree to go ahead and cover the adults. So we'll pay 90 to 100%, starting at 100%, dropping down to 90%. So yes, that's exactly right. If you are a 28-year-old dude smoking pot in your mom and dad's basement, right now, Medicaid's paying 90%. The federal government's paying 90% of your Medicaid, where it's only paying an average of 60 cents on the dollar in a state like California for a disabled mother with the child.
Yeah, I'm thinking somebody I know specifically who has like a regular person with a job and is doing it the normal way, and their incredible medical bills they got right now because they've had some health problems. That's very galling that they have these high medical bills with insurance and everything, as opposed to if you got on some sort of government plan, it would all be covered.
And Craig, I'm going to leave it up to your judgment how much you want to get into this, but there are all sorts of other perverse incentives that this law has caused states, taxing hospitals to raise the amount spent, but then they get it back from the federal government, then they give it back to the hospitals. I mean, it's Byzantine.
Yeah, let me just give you a couple nuggets on the cost of it, just because what's happened is employers pay 2 to 3 times the cost of a hospital visit as Medicare and Medicaid do. So when you're on Medicare and Medicaid, you go to the hospital, you pay X. If you're on an employer-sponsored plan, you pay 2 to 3 times X.
Wow, thus the bills I was just talking about.
Thus the bills. But even with that reality, gentlemen, if you're on Medicare, that cost per taxpayer is about $11,000 per year. If you're on Medicaid, it's $9,400 per year. And for employer-sponsored people, it's $8,700 per year. So even with that, now granted, employer-sponsored coverage, generally younger, generally healthier, we get that. But even with this tremendous cost shift to the hospitals, it underscores how inefficient these government programs are. When they passed Medicare, now this is Medicare, not Medicaid, but they did all the financials together. When they passed it, in 1967, actually 2 years in, when they did an analysis on it, they said, hey, we think this is going to cost $12 billion by 1990, when in fact it cost $100 billion. They were off by a factor of 8 with Medicare.
It's the bullet train of medicine.
Yeah, it's the bullet train of medicine. And now that there are some people making noises that, gee, we ought to trim back the edges a little bit and get these able-bodied adults off of it, you, of course, get the grandstanding of politicians, even those on the right, screaming that it's murder in the streets.
So Medicare is the one we all get when we
cynical. It will.
Medicare is the one we all get when we turn 65, but Medicaid is the one that the downtrodden
or poor folks allegedly. Yeah. Hey, Craig, I want to do the numbers you did for Medicaid too. So in 1987, Congress projected that Medicaid would make special relief payments to hospitals of less than $1 billion by 1992, under $1 billion. The actual cost was $17 billion. So they're 17 times as high. I mean, if that doesn't tell you what you need to know about government entitlement programs and what they do inevitably, well, you're too stupid to understand it, and I pity you.
And that one was in a 5-year span, Joe. That was their 87 projection for 92.
Oh, my God, you're right.
17X. Yeah, that wasn't. Yeah,
well, and one of the problems is, all government programs grow, and the high cost of good intentions and all that sort of stuff. But in this case, you've got the added part that there's a bunch of people that want the government to run all of healthcare. So they loved it. They're pushing the expansion. It's not just like normal bureaucratic creep. They're pushing it. The more people covered, the more you can make the argument of, well, we're already government healthcare anyway. Let's just flip the switch and go full on single payer.
No, you're absolutely right. And the single payer, I'm just here to tell you, the single payer path is a good 30 to 50% more expensive. Now, those costs are hidden because of the way the money sloshes around, but you've only got one payer of healthcare in America that actually cares what it costs, and that's employers. That's it. The insurance companies don't care because the way Obamacare is written, they need more claims to make more money. The government doesn't care because the more healthcare costs, the more budget they get to address the issue. The only policyholder, the only moneyed interest in this that actually cares is an employer, and it's dramatically shrinking. Those of us that get health care at work is shrinking every year.
I don't know how we ever get this fixed, because you've probably been listening and know I got whooping cough. So I've been to the doctor 4 or 5 times, 8 different medications, all these different bills, most of them tiny. I don't have the slightest idea what anything cost. Or I'll get a bill. I know I'll get a bill in a month for $180 or $580. I don't know. And then I'll just pay it. And nobody has any idea. And the randomness of those of us who have employee, insurance, we don't know if we're getting ripped off or a good price or whatever. So it's complicated.
No,
and it's incredibly discouraging. Go ahead, Craig.
Yeah, and it's not helped, Jack, by a lot of people think that, hey, I have Purple Cross as my insurance. And so whether I go to Stanford or El Camino or Good Sam for this particular shoulder surgery should be about the same price because I have a Purple Cross PPO contract, right? It's not. You can pay $10,000 for that shoulder surgery or $50,000 for that shoulder surgery with the same exact insurance card. It's utterly insane what's happening in the commercial market because government has crept into this unholy alliance with the commercial payers. And so you have this situation where it's crony capitalism at its absolute worst.
We're talking to Craig Gottwals.
And we can tease for a future visit, but there are ways to get around this. But relying on the government or this large commercial sector is going to kill us. And when I say the commercial sector, I mean the fully insured carriers, employer-sponsored plans. Self-funded employer-sponsored plans are the way to go. It's the only way to beat this and beat it back.
Yeah, we're talking to Craig Gottwals, Craig, the healthcare guru. Craig, I feel like at this point in the interview, we ought to give people the local suicide hotline number. I mean, because it's so discouraging. So we've described this incredible, mountainous, wasteful, enormously expensive government program out of control. And if you, as say a Republican, a Chip Roy, for instance, say, hey, can we have 35-year-old guy smoking pot on his parents' couch? Please pay a $35 copay when he goes to the doctor. You have Hakeem Jeffries screaming, you're literally taking health care away from millions of Americans.
Yeah, that's one problem, though. The other problem is that's a Democrat. You got Josh Hawley, a Republican, writing an op-ed.
Hawley has lost his soul. I hope he gets hit by a car. I abhor violence.
Josh Hawley writes, I think in the New York Times last week, Republicans, hey, do not cut any of this. It's a bad political move. So where does that leave you?
Yeah, you at this point, gentlemen, I put my head down. I don't even listen to the big picture anymore, and I just try and help one employer at a time. It's just and I get individuals that contact me and they ask me, what do I do? And I say, buy as little insurance as you can, buy the highest deductible. Go ahead.
Don't get sick is your recommendation.
Don't get sick, but find a doctor. Find a doctor who's left the system and engage in something called direct primary care, where you give them anywhere from $75 to $200 a month. You work with them, and then God forbid you have something giant happen. You have the highest deductible you can stomach to go deal with that issue. But you've got to cut insurance and government payments out as much as you can and work directly with doctors. And the good news is that system is growing, gentlemen. I talk to doctors every week that are leaving the system and going direct pay with individuals. And not the $350 concierge model, but like doing this for $100 a month, literally.
Well, I love the idea of starting at that point in our next conversation with you, Craig, and talking about that, because one of the things I was going to bring up, if we have time, and we don't, unfortunately, but some of the unholy vertical integration of the giant healthcare companies, where they own the doctor, they own the hospital, they own the pharmacy, they own the pharmacy benefit manager, which is an unholy, murky cesspool of God knows where the money goes. And so, the idea of checking out of that system, I love it. Let's talk off the air. We'll schedule you to come back because I think it'd be great for the good folks.
Sounds great, gentlemen. Have a wonderful day.
Yeah,
thanks, Craig. Appreciate the time.
Poor Craig. He has to come on all the time and bear bad news. I mean, it's like
I just as a realist, unlike the Biden family, the one thing you must do is understand reality, or you're hopeless.
I've been saying to Craig, and he usually agrees for years, I think the realist view is we're going to end up single-payer health care. It's just when. When does it finally happen?
I suppose so. But in every single-payer health care system, people who can afford it go outside it.
Right.
Got to learn those ropes.
God dang it.
Don't, folks. It'll be okay.
Don't get sick. Just don't get sick or break anything. That's the answer. Stay here.